Hello, everybody. My name is Patrick Bohr, and I am a third-year medical student at UCSD School of Medicine. Today, I am very thrilled to be interviewing Neeha Namineni, who is an intern at Yale University. And please introduce yourself.
Hi, everyone. I'm Neeha Namineni. I grew up in the San Francisco area and then went to both undergrad and med school at UCSD. And yes, just as Patrick said, I'm in my first year of residency training here at Yale, and I'm loving it. I'm so glad to be here.
Perfect. So can you tell our viewers a little bit more about how you chose your path in medicine, specifically like your interests in clinical practice or other like offshoot interests that you hope to fold into the practice that you've chosen to go into?
Yeah, so I chose internal medicine kind of after going into with a very open mind in my third year of med school. And I loved pretty much every rotation I was on, but I really felt like I got to experience really complex challenges, very interesting questions, while also having these great relationships with patients. And so I love kind of getting that time and then having that continuity, especially in clinic. It's really rewarding. So love internal medicine. I was really lucky in med school at UCSD, got to work with our nephrology department and really fantastic faculty all around who, showed me the ropes with research and things like that. And so I got to get involved with projects. And I felt like, I just loved the field in all its various forms. So I'm really excited and very happy to be, starting my journey in it.
Wonderful. And what is it, just for curiosity's sake, what is it about nephrology that really lights your fire? Even if you don't end up going into nephrology and you do general internal med, what excites you about nephrology?
I think nephrology is a really interesting field. You deal with very vulnerable patient populations, and you have to have a very deep understanding of the physiology of how the whole body works, because the kidney is responsible for all the homeostasis. And so I think I was lucky to have such good teachers and then really enjoy when I was learning about it. And a lot of the problems that we deal with are very interesting, because you can always kind of go back to the physiology. And I also did a nephrology consults month in my fourth year where we, got to see it in various kinds of practice. And so I saw patients in the ICU who were on continuous renal replacement therapy. I saw patients, on the floor who had like very interesting electrolyte abnormalities or new AKIs that I needed to figure out what was going on. And then you see patients in the clinic and then in dialysis. So just so many different environments to test different kinds of problems.
Nice. Okay, so for our viewers, I'm curious to know what advice you have for them. And you can sort of take that in any sense that you want, as far as like crafting their own career path.
Yeah, I remember just being in those shoes, and I still feel like I am right now. I think going into any experience here, especially in third and fourth year of medical school, with like an open mind and a positive attitude is all you can ask for. I think you realize as you get deeper and deeper into fields and start narrowing your path in medicine, you lose a lot of that exposure to other things. And as I get into internal medicine, like I won't get to experience things in like pathology or radiology as much, and those things all enhance your understanding of a patient's care. So going into every specialty in your third and fourth year, being like, I want to learn as much as I can is going to benefit you whether or not you go into that specialty. And then, talk to the residents, talk to attendings, talk to later like career attendings, see like, what was exciting to them about the field and whether that speaks to you in any way. And then I think continuously like reflecting with yourself, like, did I enjoy this rotation at the end of it? What is it about it that I liked? Like, it kind of helps with you and your personal growth. I felt like I changed a lot over the course of a year because I was put into new situations where I was learning a lot about myself too.
That's nice. Very nice. Okay, so in the spirit of wellness, I want to know, what do you think or what do you recommend for folks who might have some challenges handling mistakes? And I say that because I think in medicine, there's often a lot of pressures, either externally or internally, to strive for perfectionism and academic excellence. And what advice do you have for mitigating that kind of stress in your life?
I agree with you on that. Attitude that we do need to be perfectionists when it comes to care, and yet we are human and we err, right? So, um, I think we're a group that's really hard on ourselves compared to the rest of the world because patient care like really does demand close to perfection. This is someone's life you're talking about. It's not anything that's very ordinary or mundane. So I think it's important to put that energy where it matters. I think in medicine, we're expected to do amazing on tests, on presentations, on the academic part of it all. But ultimately, if you remember, like I need to do my best and be like doing right by the patient, that I think is where your perfectionism is actually a positive thing. And I think with the other stuff, it's kind of I have a co-intern who tells me all the time, like A+ interns write B+ notes. And I'm not saying the notes don't matter, but things like, it's that whole idea that perfect is the enemy of good is something to remember. Um, Try to put like all that energy towards patient care, and kind of for the other things, I'd say, just do your best, but don't be hard on yourself. Try to be kind to yourself. Um, it's a hard thing. I feel like I'm constantly feeling like we need to be better. It's a motivating thing, but there is a point at which that balance can tip over, and it's important to be like aware, like, oh wait, I'm beating myself up over this. Like I don't need to add to that.
Well said. Okay, so we probably have time for one last question, and this is a big question, but how do you personally contribute to a bigger culture of systemic wellness? Um, Whether it's like activities you enjoy, or uh, things that you practice for mindfulness, or whatever it happens to be.
Yeah, I think, wellness means a lot of different things to a lot of different people. And I don't think I have to like teach anyone how to be well, sleeping well, eating well, working out. Like those are all the things we all know how to do, like enjoying your hobbies when you can. Sometimes it's just about how much time we have to do them when you're coming home from a long day at work, or you have work super early the next day. Like how many of those things can you fit in? I think it's important to, go to programs, especially as students and trainees, and work at places that prioritize like a systemic culture of wellness, because if that doesn't exist, I think it's hard to have personal wellness. And I think this comes from the system listening to trainees and students. Here at Yale, we're really lucky. We have like a resident council. So, we all get to go in there and express like, here's what's going on. These rotations are actually really tough on our work hours. Like, or this is how, we could better improve our processes to give ourselves more time and more, and things like that. Prioritizing things that are important to the people that are working in these environments. And I think one way to show that you value them is supporting them with resources, whether that be like mentorship, like money, like faculty, like, just like more time, like giving them an extra, some extra time off. And encouraging community building. When we do have breaks to have, like here at Yale, like when we're all on clinic, there's like 3 classes of residents that are together, and we can all just be in clinic together, but the program gives us some money to get free food and hang out outside of work. And I think that's like one way we create community, create wellness. This is an institution that supports that, and I think it's a good example of a one way to systemically do that. And in being honest, transparent, with COVID especially, I think that lots of things have had to change, and the best way to show, like, to include people in these processes and to include us in the decision making is going to help create wellness, because we know what helps keeps us well.
I love it. Okay, well that probably wraps up our time together. Um, Folks listening, you heard it from the boss lady herself, Dr. Neeha. Thank you so much for your time. I have every confidence that our viewers will benefit from hearing your words and what you've shared with us today.
Thanks so much for having me, Patrick.
Okay, bye-bye.
Mhm.